Good evening, myself Haseena from the Department of Psychology. Today we are going to learn about substance-related disorder and how it affects human brain and nervous system in a human body. So the first, alcohol affects every system of the body, but it is greatest, most immediate, most visible effect on the central nervous system. So what it says means the alcohol majorly affects central nervous system in a human body. So if it affects central nervous system, it automatically affects the individual's day-to-day functioning, motor skills, cognitive functioning. Everything will get affected because of alcohol consuming. All the complex features of an individual's thoughts, emotions, and actions are based on chemical and electrical process that occurs in billions of nerve cells at any instant. So, yeah, as I said before, uh, alcohol affects the chemical and electric process that is running inside the brain. It interferes with neurotransmitter and brain communication. So alcohol affects how the neurons are giving signals and how it communicating the stimulus based on based on the environment and how we should respond. So it will all happening in the neurotransmitter. So the alcohol also affects the neurotransmitter and brain's communication. So it also impairs mood, memory, coordination, and decision making. So alcohol also, if it get affected, if the neurons get affected, it automatically impairs the individual's mood, memory, coordination, and decision making. So it also disrupt chemical messages crossing synapses. So if it affects the chemical messages and signals that are transferring between two neurons, it affects the incoming and outgoing signals in the brain. So, women appear to be more vulnerable than men. So, alcohol majorly affects women. Women appear to be more vulnerable than men to some of the differences in the consequences of alcohol. So, women are at higher risk than men. So, it will lead to, including it will lead to heart damage, brain damage. In addition to metabolism, research has tried to better understand gender difference. So yeah, so alcohol, women and men are built different, right? So women are more sensitive to alcohol. So obviously, alcohol affects women's brain chemistry and genetic risk comparatively to men. So next one is genetic factor. So article says alcoholism runs in family. For example, sons of alcohol are about 4 times more likely to have the chances of getting addicted to alcohol. So, example, adoption study shows that it is true even when the child doesn't know about their biological parents. It has the significant influence or exposure by their genes or DNA. If their biological parent has the addiction of alcohol, obviously it affects the child even when the child doesn't have the direct exposure from the parent. That is what the adoption studies telling. So now it is clear that alcoholism is not a single disease. So alcohol it is not a single disease. It may lead to many other abnormalities between a brain and physical functioning of the brain. The next one is psychodynamic approach. So the psychodynamic approach looks at conscious and emotional conflict underlying underlying the causes of alcoholism. So MC Jonas conducted a longitudinal study. In this study, he used also 10 individuals who were 10 and of years old. Has this individual reached adulthood, the same individual has the chances of hostile, submissive, social anxiousness, and unsuccessful and social anxieties. So it shows that people may use alcohol to manage their negative feelings, but it won't solve their temporary problems unless they have the coping skills to manage it. So the theory says people are using alcohol to manage their temporary problem or to manage their negative feelings, but it leads to some other difficulties like low self-worth, emotional distress, and cognitive abnormalities. So next one is the same. The therapist from this approach often recommend psychotherapy to for alcoholics to understand and resolve their unconscious conflicts. So people won't look for their unconscious thought. So the alcohol intake is mostly using. In the past, psychotherapy was based on the idea that alcoholism was a symptom of unresolved inner conflict. However, it is now understood that therapy provides limited value if the person is actively drinking, and consistent structured sessions are needed for it to be impactful. The next one is cognitive behavioral therapy. So, cognitive behavioral therapy is mostly used to change individuals' cognitive functioning. Like we can use CBT to change their thought process, how the individual is thinking, and how they are contributing to their environment. So, one major reason people drink is because of the reinforcement they're getting from the alcohol. So we have two types of reinforcement. The first one is positive reinforcement and negative reinforcement. Positive reinforcement is nothing but getting the pleasure feeling of high. So negative reinforcement is nothing but to reduce their stress, anxiety, and emotional pain. So people often repeat drinking behavior to cope up with their negative feelings, that is to get the positive feelings from their negative reinforcement. So the behavior is often learned through modeling, peer influencing, and social learning. So seeing others cope with stress by drinking, so other people will get the same. So it's being accepted by group that values drinking, observing others' behavior and consequences. So these are the main reason that people get addicted to alcohol. So thank you. We'll continue the substance related disorders discussion on the next